Hey everybody, welcome. This is the Rotary eClub of Silicon Valley, and every week we try to bring you stories of innovation, entrepreneurship, and education as they relate to service to others. And so we are always excited to find uh, different ways that those ideas come together. And we are going to be talking with a Silicon Valley native today. Our speaker is John Carpentier, and he is going to tell us about the Glide Foundation in San Francisco, an organization working with some of the toughest cases on the streets, and showing a certain level of compassion and ability to help that I think will inspire you in many ways. John is a native San Franciscan and a proud NYU graduate, and serves as the corporate engagement lead at Glide. And so, John, we are very happy to have you, and we hand it to you.
Excellent. Thanks so much, Russian. Excited to have the opportunity to share with everyone the nature of the Glide Foundation, our history, and then a little bit about the work that we do today. So getting started, we'll get into a broad level overview of what the organization is, just at a glance, get into a few of our programs with some time to get into question and answers at the end. So for those who may not be familiar, sort of the back of the baseball card is Glide is the largest pound for pound provider of homelessness relief services in the Bay Area. That role has never been more in need of someone to take it than right now in San Francisco's history. Since the 1960s, 1970s, the city has always struggled with transiency, income inequality, and homelessness, but that problem has unquestionably been growing at an exponential rate each decade that passes. Right now, the official census count of homeless individuals just in San Francisco County alone is 8,301. But there are some individuals who estimate that if you look sort of more at the borders of that, past the limitations of certain person-to-person data collection, that if you count people who are living in their cars, living at an SRO or single room occupancy illegally, or crashing on a friend's couch even, that is a form of transiency and is an individual experiencing homelessness, that number might be close to 20,000 individuals out of the city's population of 830,000. So the need has never been greater, and proportionately, somewhat unbelievably, it is the highest rate of homelessness in any major metropolitan area in the western part of the world, and certainly in the United States. So we'll be getting into, like I mentioned, just a broad level overview of Glide, and then a few deep dives into some of our most well-known programs today. This is at a glance the mission and vision of the organization, information that can be seen on our website, which will be available at the end of the slides, and the links will be available for distribution afterwards. For everything that is encompassed in this mission, I would say if you need to walk away with anything, it's those two words in the first line: radically inclusive. This is a very particular phrase coined by the founders of the Glide Foundation, namely Reverend Cecil Williams and his wife, Janice Marikatani, really kind of a social justice power couple. I'll speak a little bit about their history, but both people of color. Reverend Cecil Williams, a leader in the social justice and spiritual community, his wife at the one time the poet laureate of San Francisco. So artistically minded, socially minded, politically minded individuals who are really inculcated in the spirit of San Francisco. The very, very brief history is that the Glide footprint in the city goes all the way back to 1929, when a church by the name of Glide Memorial Church was built at what would become the intersection of Taylor Street and Ellis Street. That was built by a woman named Lizzie Glide. She kind of lived the dream in that she and her husband built a house. That house turned out to be on top of an oil well, and they got about as rich as you can get overnight. And they used that money to build a church. And that's really all that it was. It's not, tied into the work that we do today, but it is our namesake. In time, in the 1960s, when the neighborhood in which we're situated, the Tenderloin neighborhood of San Francisco, became a much lower socioeconomic neighborhood for a variety of factors, Reverend Cecil Williams took over as pastor of the church at the time, before the foundation existed. And so he was the first pastor of color for the church, and his charter was essentially to say, I want the people outside the church to be the same people who are inside the church. I don't want there to be that class divide, that kind of informal caste system. And he did a lot of things that really kind of upset the established order, becoming radically inclusive. That's when he coined this term. It was really a melting pot of social justice. They brought in leaders from not just across the city or the country, but the planet. They brought Dr. Maya Angelou, they brought Desmond Tutu, they brought Angela Davis into the church in order to speak to impoverished and marginalized communities and figure out the needs that they had. Out of that discourse, the Glide Foundation was born. Reverend Cecil Williams, Janice Mercatani took over as the executive directors of it, and it had very humble beginnings, just giving out a couple of dozen free meals to individuals down on their luck to alleviate suffering and outreach into the community. A glance into the time through history here, there on the left, you see Reverend Cecil Williams and Janice Mercatani at their official wedding ceremony, riding there on Muni, just like the rest of us do these days, though not as much in COVID times. And then on the right, you see the inside of the Glide Memorial Church as it was back in the 70s, and that's Maya Angelou delivering not just her poetry, but also a sermon about what was so important about giving back to those in need in San Francisco. Today, the program that we're most well known for is our daily free meals program. It has grown, I'm glad to say, commensurately with the times and with the need. So when you compare it to the few dozen meals that used to be served from the Foundation Center back in the 1980s, we'll now serve just over 2,000 meals in a single day out of our meals program. We keep that running 364 days a year. So it amounts in an average year to just about 750,000 meals that get out the door in a single year. Obviously, all of this, it is an indoor dining room that accommodates 70 people at once, has had to change in a very fundamental fashion in order to, be COVID compliant and be safe and responsible for our staff and our community. I'll get into it a little bit more towards the end, but these pictures give you a glance into how things have changed. The picture on the right shows you our regular dining hall and tables where people would normally be dining, now being used for meal assembly. And the picture on the left shows you how we get food out to our community during COVID. We'll have staff volunteers that hand out clamshells or portable meal containers that contain fresh cooked food through a teller box, just like you might see it like a Safeway or at your bank in order to be COVID compliant. All clients are kept 6 feet apart in the line, and any individual who doesn't have a mask or is in need of a new one is given one. We're giving out hundreds of PPE safe masks every single week that we operate, and in no small part, that has been what has kept the neighborhood very COVID safe and at a very minimal transmission rate. It is one of the things that we miss most is providing that kind of safe harbor for the clients that we serve. There are several individuals who have called Glide over the years an oasis for those in need, and it is tough to not be that in the same way, provide a moment's worth of shelter in a dining room or in a care facility. But we're glad to say that none of our services have been have had to be shuttered or even downsized. And again, I'll speak to the impact of COVID and how we've addressed it a little bit more right at the end. This is at a glance, right before COVID, how our program was serving. We actually upped our distribution quite a bit that year to 802,000 meals that we got out the door. The thing that's unique about Glide's program, why we call it a meals program, rather than the more pejorative terms of like a soup kitchen or a bread line, is that every single meal that we serve is fresh cooked. There's a fresh cooked protein, fresh cooked starch, fresh cooked fruit, or not fresh cooked fruit, but fresh fruit and fresh vegetable that goes out to our clients, along with unlimited water, which is such a crucial need. We have some specialized food partnerships that let us get food from great restaurants like Atelier Cren, let us get fresh seafood from fishermen who operate out of Pier 39, in order to provide that little X factor for our clients, making sure they're not just getting the minimal nutritional needs, but getting that kind of soulful element of quality food. In an average year, that's why we welcome so many volunteers. It's been one of the hardest parts of COVID is that on average, we have 30,000 volunteer slots in a single year. The reason that we do that is so the staff that we can hire them from our community. Many of them are one-time clients of Glide services, and then they can focus themselves on becoming cooks and chefs to make this food rather than only doing the tasks of getting out plates and serving food and intaking clients. That is really the backbone of our services is that volunteer support. And it's been one of the challenges to pivot without it. I'll briefly go over some of our other programs. More information can be found at our website through some of the links I'll share at the end. But these are some of our programs in addition that have the biggest impact and are the most well-known. So in addition to our main building, the Glide Foundation building on Ella Street, a little farther down, we have a separate facility for our Family, Youth, and Child Care Center, serving children of a variety of ages up to about 12 or 13, and giving them all kinds of vocational and educational services and getting resources out to them and their families. Our walk-in center is kind of the umbrella of all of the direct client services that we provide. Obviously here you're seeing pre-COVID time pictures, but we have still been able to do a similar teller window to get out hygiene supplies, to help folks apply for their Social Security income, to get people Muni rides. We've done a number of partnerships that let clients get free Lyft or Uber rides to healthcare facilities and shelters as well. And now they provide tens of thousands of units of service, basically anything that goes to a client just in the course of a single year. Here's a picture of our walk-in center staff giving out a bunch of PPE and filtrated masks through the main facility at the main doors as clients walk by. Our Center for Social Justice is kind of our legislative and policy arm, looking to change the roots of marginalization and racism and white supremacy in the city and battle income inequality, which is so rife in San Francisco. And our Unconditional Legal Clinic provides free, pro bono legal services to clients a couple of times a week. We've been able to continue that over Zoom. And our harm reduction programs, that's basically an umbrella term for health care provided for any individuals with substance use and abuse disorders, which are very common among the homeless population and in San Francisco. They, are a very kind of like hands-off service, but very client focused. They're not going to force anyone into a program or to change their life, but they are going to educate them. They are going to test them for HIV and Hep C, the most common communicable diseases as a result of needle sharing, and teach them a lot of prophylactic and healthy behaviors, in addition to giving them hygiene supplies. Now, of course, they're also doing symptom screenings across the city, not just in the Tenderloin. A bit about COVID. I'm going to move quickly through it just in the interest of time, but something to keep in mind is that the community that we serve, these are the individuals who are really suffering from COVID. It's not just frightening, it's not just an inconvenience. They can't shelter in place. They can't work from home. They have to willingly get out into the world and risk transmission every single day and may not have the resources to get their own PPE. One of Glide's proudest accomplishments is that in standard times, we would distribute just about 14,000 meals a week. In the first 3 months of COVID, we upped that to 25,000 meals a week, giving 15,000 on site to our clients, but delivering an additional 10,000 to the smaller nonprofits, to the shelters and SROs and schools who don't have the resources and connections that we do in order to make sure that we're lifting everyone up. Moving everything to Zoom has been very difficult, but again, like I've said, we haven't had to downsize or shutter any program. They have been able to pivot sometimes with roadblocks, but by now pretty seamlessly. We've deployed a fleet of vehicles, a mobile outreach program in order to give out food, water, hygiene supplies, PPE, disease testing, and symptom screenings at neighborhoods across the city, Potrero, Bayview, Chinatown, everywhere where there's a need, not just in front of our front door. And our Family, Youth, and Child Care Center has kept all of its children and families, over 400 of them, into its programs throughout the year during COVID. We are the only COVID-19 testing site in the Tenderloin neighborhood. In addition to that, we do it through a partnership with the city and the Department of Public Health. Any individual can come out without an appointment, without a car, without identification, even without an email or a phone, and receive their COVID results within 24 to 48 hours every Tuesday and Wednesday between 10 a.m. and 4 p.m. And we test over 500 individuals every day that it's open. A brief look, again, in the interest of time, I'll breeze through it, but we just got through the holidays, and this is when we make some of our biggest impact to the community. We've had to pivot these programs, such as our grocery bag giveaway, which is when 6,000 clients would line up in the 2 city blocks in front of Glide. Can't do any of that now, so we had to pivot to an entirely delivery-focused model. This year, we were actually able to exceed our usual impact in a given year, which was pretty incredible, and give out 5,300 bags to those in need, each one able to feed a family of 4. And it's not just basic rations, that we're talking fresh chickens or fresh turkeys, tofu, soy sauce, oranges, bread, really something that can create not just basic needs, but give the family something that often we all take for granted, which is a proper holiday meal rather than just the basics. Our Toy Wonderland, an example of what we always try to do, not just alleviating suffering, but fostering growth in the community and excellence, is the children who comprise our Family, Youth, and Child Care Center program. We brought in toys from the community, donated or from corporate and institutional sponsors. We brought in over 3,500 of them and gave out over 700 bags full of toys, 4 or 5 really high quality toys to these children. Which can seem like a small thing sometimes to those of us on the more privileged side of society, but there are children here for whom receiving a gift of any kind is not and has never been a reality of their holidays. And this is a great way to provide that extra bit and make it clear that they are equal, that there is no great divide between individuals who are down on their luck or in a low income bracket and the rest of us. If you want to learn more specifically about how times have changed and how we're staying ahead of the COVID-19 pandemic, you can head to glide.org/COVID-19. Many other pages through our website to learn more about the individual things I spoke of. And of course, I wouldn't be a true fund development individual if I didn't include this. If you head to glide.org/donate, you can make a contribution as a group or as an individual, and even choose, if you are so motivated, the specific program that you would like your donation to serve. To give you a concrete example, a $50 donation, you'd be single-handedly responsible for feeding 10 clients, not just the materials, but that includes utensils, packaging, staff time, prep, all of that. So just a pretty simple donation for most of us goes a really long way. When you imagine that an individual might not have eaten in 3, 4, 5 days, this can really be kind of a godsend to them. And that wraps it up. I'm happy to answer any questions that you might have about Glide, our history, or any of the specific programs that we looked at a glance.
Fantastic, John. Let's introduce who's on the recording. You might want to stop sharing the screen there. We'll go to kind of speaker view on this. And so as I call your name, just a wave at the camera. We have in Houston, Texas, retired Judge Rory Olson. All right. In Walnut Creek, we have our paella master for the club, Shag Shagrin. My name is Rushton Hurley. I'm in San Jose. I'm an educator, and I am curious about when we think about just this persistent issue of homelessness. I think of San Francisco as a place where there's a lot of kindness. The weather's fairly good, which I'm sure is not a small part of why it's the I forget the exact metric you use to describe it as having more more homeless people,
by proportion.
Density. Yeah, by proportion, than anywhere else in the country. Is that also a failing of San Francisco or California to provide services that are common in other parts of the United States? I'm sure that we could identify differences between the U.S. and the rest of the world, but just starting within our own country, is that something that seems to be a part of the equation?
I think we might need an additional 2 or 3 hours for that question, but trying to get at the root of it. Homelessness is not something that is unique or kind of specifically endemic to the San Francisco Bay Area. What makes it so interesting and kind of dichotomous is that we are the wealthiest sort of by capita, and even looking at rent rates, something that can be a bellwether of how income and wealth is changing in a city, is the rent of a single bedroom apartment. And that's astronomically higher in San Francisco than pretty much any other city in the country. So that's part of what makes it unique. I mean, obviously there are other places across the world where there are greater numbers of homeless individuals in countries that are struggling. The kind of unique challenge and sort of the really unfortunate thing about San Francisco and its income inequality, and what we all as individuals on the more privileged side of society have to come to terms with, is how we can have all that wealth and still have so many people who go without. Why is it being hoarded? Why is it not being distributed? Not in like a direct wealth sharing way, because it doesn't even need to be that complicated. It's just, how do we lift these individuals up? Individuals will hear rumors about like, well, back in the 1970s, they used to put the homeless people in LA on Greyhounds and ship them out to San Francisco. And there's just a lot of strange urban legends out there that come from like, things that happened once or twice in decades worth of history. But the reality is just that when an individual and a family is homeless and without regular resources, it's just hard to move. It's hard to relocate. So if you grew up in a family that was transient or homeless or in an SRO and you didn't have higher education, you're going to stay where you grew up because that's where all your minimal resources are. That's where everyone that you knew are. Homelessness is very much generational. There's kind of this misconception that individuals are flocking or like coming to San Francisco because they're homeless. That may happen in a handful of cases, but it is not the root of the problem. Really what we need to look at is our infrastructure and how we lift others up instead of just ourselves up. What makes San Francisco's problem as the final note so unique is that the Tenderloin district, one of our lowest socioeconomic districts and where Glide is based, is flanked by the city's 4 most affluent districts. And that creates this kind of urban sprawl that makes it so hard to attack the root of the problem and leads to, the elevation of some less enlightened voices around the issue, talking about that they just want these individuals gone, which is an unfortunately non-human perspective. So first is things like this: education, tearing down misconceptions, and then getting greater support for these resources and programs.
Excellent. Now, when you think about these programs, a lot of these programs, I think Reverend Williams used the term radically inclusive, right? I mean, you talk about, things like providing clean needles, right? I mean, if you're going to get information to people who need good information, you got to start somewhere. And it has become more and more accepted that is a legitimate path to getting to people, but it's still the kind of thing that makes people go, is that a good move, right? Are there things that started with the Glide Foundation or with the church that have become a part of programs across the country? Would you say that you've launched a number of initiatives?
I don't know about a number, but we certainly have launched initiatives. And then especially in California, we've broken a lot of ground. The reality is that America is behind the world. Certainly the first world in a lot of its, call them healthcare, call them human services. We're drastically behind, actually. You bring up like syringe access services, which is the technical term for providing clean syringes. If there's one thing the Trump era has taught us is that data will not convince people of everything, even if it has been proven and reproven. People need to find a way to connect ideologically with an initiative that's being performed. The most kind of dramatic example of this, staying within the harm reduction realm, is that in August of 2018, Glide provided a demonstration called Safer Inside, which was a theoretical model, essentially one that was functional, but we did not operate because it would be illegal under current California law, of what's called a safe injection site. These are healthcare facilities which have had massive success in places like Vancouver and Copenhagen, where there is an endemic problem of individuals overdosing, usually on some kind of opioids or narcotics. In San Francisco, that's specifically heroin and fentanyl most commonly. And this is a location where individuals who are currently suffering from a substance use or abuse disorder can come under one roof, be supervised by healthcare professionals, consume the substance which they are consuming, and be monitored during that time. The idea being that these are individuals who are not yet ready, do not have the resources or the support structure in order to cease use of this substance, and that it's far better for healthcare professionals to make sure they don't die than have them be pushed to the margins of society and lead to dozens, if not hundreds, of overdose deaths in the course of a single year in one city. The reason that we did that is that Vancouver, once they opened their safe injection site in that area and in that building, they didn't have a single overdose death in the course of a single year. Glides, the Safer Inside demonstration, you can look it up as that, brought a lot of attention to it. During the time that it was released in the news. Our current mayor, London Breed, her younger sister actually died of a drug overdose. So she has been a strong proponent of programs like this. And a bill in order to legalize such institutions is actually on the desk of Gavin Newsom, the governor, right now. That, along with something which I won't dig too deep into right now, but in that same year, we helped compose and sponsor a piece of legislation called Proposition C, which levies a tax on all corporate interests which have an annual revenue of 50 million or more, in order to go back into an 8-fold path program to help lift up individuals who are suffering and in need. And we were a big driving force behind that, and something that we hope other wealthy cities will do.
The reduction in deaths is clearly a plus. I would guess, but correct me if I'm wrong, that there is also a financial benefit to making sure people don't immediately end up in the most expensive elements of healthcare in emergency rooms or something like that. Is that
exactly?
That accurate?
Exactly. There are a lot of elements to it. So first, to the death part. The really big problem that our society is facing in a granular level with substance consumption is this drug called fentanyl. You may have heard about it on the news. If you haven't, it's a very specific, very potent lab manufactured chemical which can be mixed in with drugs or given on its own, which is roughly kind of it's not specific, but the back of the hand statistic is that it's about 100 times stronger than heroin when an individual uses it. To give you an idea, if you have not consumed that substance before, you could have as little as a pinhead's worth in any form of consumption, and it could kill you through an overdose. The problem is many of these individuals suffering from these substance use and abuse disorders, classified mental health disorders, and they will often have many other kinds of healthcare or mental health care issues on top of that, are usually or often unaware that this chemical has been placed in the substance that they use. In terms of the death component of that, if you overdose on heroin as an individual, you have about 15 minutes to be administered a drug called Narcan, which halts an overdose. If you have even a small amount of fentanyl in your system, that number goes down to 5 minutes. And if you imagine an ambulance trying to reach someone who may be in an odd location or on the streets in 5 minutes or less in metropolitan San Francisco, it's a long shot. And then if somebody even sees it in those first few moments. So facilities like this would be saving if they could be opened in cities in San Francisco. Another one that's pushing for it is Philadelphia. We're talking about the cessation of dozens, if not hundreds of deaths per year. And then as to the infrastructure point, yes, there's obviously a lot of data and we can get very granular, but as you said yourself, the main load lift is on EMS, first responders, police, emergency room staff, like St. Francis Hospital in San Francisco. A significant percentage of the individuals that they serve on evenings are individuals who have suffered an overdose or near overdose. Sometimes who have to be brought in repeatedly. If they could be educated and cared for, they might never have to go back into an urgent treatment facility again. And if they have little to no resources, how are they supposed to pay for those kinds of healthcare expenses? So the city and the hospitals have to absorb that expense. And we can get rid of all of that through a few of these programs.
I know that Rory in Houston has, as a judge, was a major voice for helping those in difficulty. Rory, if you'll unmute, I know you've got a question ready as well. Oh, let's see.
Okay, there we go. Yeah, hi. Jen, let me offer 2 comments. They're comments. I don't think they're going to solve all of your problems, but I'll just give you my perspective. For 20 years, I was one of 2 judges in Harris County who did mental health commitments. So I have gotten to know a lot of people who suffered problems. And I can tell you that Texas, not as rapidly as California, but we eventually followed course and deinstitutionalized a lot of people, which to some extent was good because if they're no longer a threat to themselves or others, they probably ought to try it being out in the real world. But what it got to was they were looking for the medical standard. Is this person no longer a threat to himself or others? And then they release them, and then they will be in trouble or be back being mentally ill in a week or two, and they come back again. So probably the best thing that I ever did as a judge was I talked to the mental health authorities and told them our problem was, even though when our hospital was built in the 80s, it was quite adequate in terms of patient capacity, but every year the number goes up and up and up, and then we don't bring people back. So they're not done yet, but they're close to being done with a new hospital, which will add on to the older one. And it will do two things. One, will increase the capacity. And secondly, there'll be an intermediate step for people who they can find jobs for, but they will come back at nights to be tested to see if they've been on drugs and things like that. And I have no idea if it'll work, but it's the best a lot of minds could come up with. And the other thing, which until fentanyl became really a serious problem, which we know what it is today, as you said, but for years, there were so many people who weren't necessarily mentally ill enough to really deserve treatment, except for the fact that they were doing so much marijuana or so much coke or the variants, even before fentanyl. You could take somebody who was only marginally mentally ill, but if they were self-medicating, they were making it worse, and either they became homeless or wound up in the hospital or both. So my thought, not that anybody asked, is we have to address those problems. And of course, the fentanyl, as we know, there's a PRC involvement with it, which they ship it to people in Mexico, and it comes across the border. Under the current administration, I can't expect him to interfere with the PRC, but that's where the fentanyl is coming from.
All right. We will continue the conversation after we finish the recording, as we always do. It is one of the perks of being in our club, or at least joining a recording, even if you're not in the club, to be able to talk to the interesting people that we bring in. So with that, I would like to encourage any of you who are visiting to let us know you were here. There is an attendance form just a little bit farther down the page. And then below that, there's the discuss section where we hope you will leave a comment and add your thoughts to the conversation. It is an opportunity you have not just to say what struck you about the meeting or the program, but also to respond to others. So with that, we'll finish up. And as we always do, we hand it back to our speaker for a final word. John.
Great. Well, yeah, thanks so much, everyone, for the opportunity to not just present, but have a good conversation and address some of the more complicated issues afterwards. You know, as you saw in the presentation, and you know, I'm sure we can make some of it available in the after presentation materials. You can head over to www.glide.org in order to learn more about the programs, about the history, about our work during COVID-19, and if so motivated, to donate or support the organization. You know, what's even more important than that is that dollars and financial contributions, while, you know, sort of the bread and butter of nonprofits, is not the only way that you can support, you know, especially now where individuals of all kinds are experiencing financial hardship. A lot of it is just getting the word out there, kind of signal boosting, as we would call it. So, you know, have conversations in a small group or large format, share the work of Glide, share the stories of some of our clients on social media, if so inclined. As I mentioned earlier, really the first step and most crucial step in all of this work and serving individuals in need is breaking down misconceptions and preconceived notions of how these individuals suffer and what is most effective in helping them re-enter society and make use of the programs that we can provide to them and changing the legislation and policies that are around. So learn more, head to glide.org, learn about other nonprofits, learn about the lives and stories of hardships of homeless individuals. And we always like to try and turn sympathy into empathy, feeling along with people rather than just kind of commiserating about their problems. And that's all we can ask for at the end of the day. So thanks so much for taking the time to learn about us, for learning about the clients that we serve, and we hope to hear from you in the future.
Thank you, John. And for everyone, we will see you next week.